Hey guys, so it's Thursday and it's time for another Q&A. I hope you don't mind that I don't have the phone on the gimbal because it's going dead and I have to charge it, and I've had a rough day and it doesn't fit with the charger and the gimbal, and you get it. But I'm going to answer some questions. So I've picked out 7 questions that I've gotten over the past week on YouTube, Facebook, Instagram. I'm going to get into that. But if I missed your question, or if you have a question for me, I'm going to be going over these comments over the next week, and I'm going to be screenshotting and selecting more questions to answer on next Thursday's Q&A. Can people see that your teeth are a bridge if you smile real big or scrunch your nose? What about if you throw your head back laughing, or you're taller than someone? Kids don't miss a thing. Okay, so what they're wanting to know is, when I smile big, can you see this or that? And if I'm taller than somebody, can they look up in my mouth and see? I don't know. Can you see? Unless you pause the video and zoom in and really look for that. No, people do not see that. In fact, I've been out in public many times and I've gotten compliments on my smile, because even if it looks, nice and natural, it doesn't look natural because it's so white and straight. Who has that? It looks like, if anything, I've probably had some dental work done. I might have some crowns, some veneers, maybe I had braces, or I had bleaching done at the dentist. So oftentimes I've been asked, what kind of toothpaste do you use? What have you had done to get your teeth that white? They are looking for recommendations to get their smile to look like mine. And I literally have to prove to them that these are not my teeth. When I say, oh, well, they're that white because I picked that shade when I picked the teeth, because none of them are real, they don't believe me. So I'll show them hey, that is a full-on, basically a denture that goes into an implant. And then they believe me, and they're just completely blown away because they're not looking for that. Unless you have problems with your teeth and you've been obsessively poring over information on the internet, or unless you're a professional, like a lab technician that makes these day in and day out, or a dentist, prosthodontist, somebody in the dental community that has a trained eye to look for these, they might be able to notice. They might even be able to tell me exactly what shade I have in my mouth. You know what I mean? But for everyday people, when you're just going about your day, living your life, no, they can't see anything and they can't really tell. So I've gotten this question pretty frequently over the past week, and it's about facial support. She's wanting to know if there's a difference between, the facial support provided from dentures versus implants. Honestly, with dentures, you get more facial support because your dentures can be removed, so they can really bulk it up around in this area. They can push it down pretty far in here, pretty high up in there, to fill out your face to where it doesn't sag. Because if you have dentures, think about what you look like when you take them out. I mean, I don't look any different. When I take my teeth out, everything caves in, everything sinks. There's nothing there to support that. And that's just the way that it is. So with dentures, or even an overdenture, like a snap-in denture, they can really bulk it up. But with the hybrids, they can't do that. They have to stop at my gums. There has to be enough space between my gums and the hybrids to allow the water pick to get in there, to clean it, floss, all of that, so that food doesn't get trapped. Because if food gets stuck in there because there's not enough space and I can't get to it, it's going to create infections, and then my implants could fail. So it is an issue that you can see with hybrids. I saw it with my first set and my second set from Dr. Golpa, though it was something that only I noticed. When I brought it to other people's attention, they were like, what are you talking about? So even if you do notice it, other people probably aren't going to see what you're talking about. But I noticed that my lips kind of were a little bit thinner, and this area right here, there's a dip there from the bone loss, and it wasn't pushed out. And so with the set that I had Ivoclar make, I asked them specifically about that. In fact, they did a wax mock-up of an overdenture, like a snap-in denture, to see if I liked that better, just because they can provide more bulk, more facial support with a snap-in denture. But it was I really love the all-on-4. This is the only issue that I have, and it's not even a big deal. What else can we do? So I have more acrylic back here, and they were pushed forward. Like my teeth were pushed as far forward before they compromised, like, you know, the function, like my ability to chew or the stability of it to where I'm not cracking teeth and popping teeth off of the hybrid. But they took it into consideration that, you know, I wanted that full lip. And at first there was so much lip support up here that it felt like I couldn't get my lip over it. Like it took a little bit of time for me to get used to just how much they bulked that area up. But they did it because they're good at what they do, and they listened to my concerns, and they really pushed it to the limit to give me as much support as they possibly could with these. Another thing is that Dr. Martin made me what's called a lip bumper. And a lip bumper is basically just acrylic that they mold to this area down here. And then it cures, it hardens, and now you've got something that is exactly the shape of that area, and you can pop it in and pop it out. You don't need adhesive. It just fits in there like a puzzle piece. And then when you're done with it, you just put it in a denture bath and you soak it. I do not remember if he made me one up here. I don't see why you can't. If you can't, and you know you can't, if you're a professional, leave it in the comment section below. But it's not something permanent. It's not something that alters this. It comes in and out. It doesn't have to be glued in. It just fits in place like a puzzle piece. And then when you're not using it, you soak it. So that's an option that you can bring up to your dentist. If you had to do things over, would you go to Golpa again? Absolutely. Dr. Golpa is phenomenal at what he does. I was there for 3 days. Day 1, they took the measurements, they took the molds and everything. Day 2, they placed the implants. Day 3, they loaded them with the hybrids, and I was on my way. I was not thrilled about the way the temporary set looked. I didn't like the color of the gums. I didn't like how straight they were. They didn't have as much character, but they're temporaries. You know, they're going to be replaced. So when I mentioned my concerns to them, they changed the second set. Now, you'll remember when I did the Fenarez video, when I first got these teeth, I was comparing these to those. I want to make it very clear that both sets, the Fenarez and the ones that I got from Dr. Golpa, were significantly better than my teeth. And honestly, a lot of the things that I noticed were things that only I would notice. A lot of other people, they're not paying attention to that at all. You know what I'm saying? But I did that video to show you the comparison, because if you're spending your money, which I didn't, I won mine in a contest. If you're spending $50,000 to $60,000, you're going to want to know that there is an option out there to where you can get more natural looking teeth at not a lot, you know, more money. Like, you're not going to spend a lot more money to get it. So why not? You know what I'm saying? But that's not the most important thing. Like, if I cracked these tomorrow, my dentist has a mold of it and can make another set. You know what I'm saying? Like, the implants, that is the most important thing. And I have never had any issues with them. None of my implants failed. I have had no infections or anything. Like, they were placed very properly, and it's because Dr. Golpa knows what he's doing. And I absolutely would recommend him to anybody. How was my recovery? Okay, so my recovery from implants was a lot different from my recovery from the extractions and getting dentures. With extractions and dentures, it was an immediate trauma that was very intense. My face swelled up. I looked like a gopher that was storing food in his mouth. Like, it was really bad, and it was very painful, to the point where I think that my fight or flight kicked in, and I was on so much medication that I just slept. Everything was a blur, and it's hard to even remember. 2 weeks later, I was eating and I was talking, and everything was fine. With the implants, it was, you know, I think it was because the implants go down into the bone and you're feeling something that was not previously there. And so while it's not an intense pain and there's not a lot of swelling, it is a constant ache. At least it was for me. For like 4 to 6 weeks, it was just, it felt bruised almost. And even with ibuprofen, like, that helped take the edge off, but it didn't go away. Like, it was a constant, persistent ache in this area. but it never prevented me from functioning. I was talking properly and I was eating properly. Day 3, I bit into a steak. So recovery with implants is pretty straightforward because it's minimally invasive and it's just a very, easy, quick procedure. So at least that's how my experience was. What type of paste do you use to clean your hybrids with? Listen, it doesn't matter if you have hybrids, overdentures, or removable dentures. You do not need to be using abrasive toothpaste. If you're using the same kind of toothpaste that the rest of your family uses, it's probably going to be scratching up your dentures or hybrids over time. Like Crest 3D whitening is great, but when you squeeze it out onto your toothbrush, you could see it's a little gritty. You can look at it and see the little particles in it that kind of like scrub the surface stains off. You don't want to do that with these because these are not real teeth, and it's going to put little tiny cracks in them that's going to cause them to dull over time. They won't look as bright. It removes like the sealant on them, and then it also allows stains to like really catch into those cracks, and then you're going to get like, yellow teeth. So Sensodyne, or like I've been using recently, is Dr. B's toothpaste, which is very similar to Sensodyne. When you squeeze that onto a toothbrush, it looks like lotion. It's very shiny, very slick. You don't see all those little teeny tiny particles in there. And when you put it on your teeth, like you can tell it feels like soap for your mouth. You know what I'm saying? Like it's just not got the scrubbing agents in it. And so it's pretty safe for your teeth. So that's what I would recommend for everybody who has prosthetic teeth. What is the time period or process from changing from dentures to implants? Will it be difficult to glue in dentures while the implant spots are healing? Okay, so every dentist offers different types of solutions for mouth, full mouth restorations, implants, and things like that. For me, I got the all-on-4. I didn't have teeth when I had them. Like I had been a denture wearer for 3 years, so there was a clean slate to work with. But from what I understand, it's called Smile in a Day because they can remove your teeth and pretty quickly after install the implants because it's not a very complicated procedure. It's not an invasive surgery. It's minimally invasive. It doesn't take long to do, and the downtime is very minimal. I mean, you might be down for like a day, if that, a day or two. So you heal pretty quickly from it. So from what I understand, if anybody's offering the all-on-4, you can pretty much have your teeth extracted not too long before you get the implants. So I don't have any experience with that. If you have experience with that from going from teeth in your mouth to implants, then leave it in the comment section below because I'm curious to know. The last question is my favorite because it is seriously something that crossed my mind because I flew to Vegas to get my implants. And that is, do you set off metal detectors at airports, for example, if you have titanium dental implants? And if you do set off metal detectors, do they follow up by waving the metal detector wand around your face, alerting everyone around you to your implants? Okay, like that's exactly the visual that I got when I had my implants. No, titanium is not going to set off the metal detectors. My husband has a titanium plate and screws in his leg from when he had a scooter accident in his teenage years, and he doesn't set it off. I've never set it off with my implants. I have, however, set it off with my hair extensions. Back when it was either in 2015 or 16, I went to Toronto or Chicago or something for Ivoclar, and I went through the metal detector and it started blaring, and they pulled me to the side and they were like waving the wand and stuff, and when they got up to my hair, it set it off because I had the clip-in metal, like the metal clips that hold the wefts of hair in, and she's just waving it and it's just beeping like, okay. But at the same time, even if you set off the metal detector, who is paying attention to that? Everybody's just trying to survive that. Like that whole TSA thing gives me so much anxiety. That is the worst part about flying to me, is standing around all of those people, taking my freaking shoes off, trying to quickly load all of my stuff into these little bins and then make it through without being tackled. Like I've got I've got anxiety about that. Nobody is paying attention to if you set off the metal detector. They're too busy trying to gather their stuff. You know what I'm saying? But no, titanium doesn't set it off. So anyways, that is today's Q&A. And again, if you have any questions, I'm going to be going over them over the next week. And then I will be doing another Q&A next Thursday. Also, I have been doing videos on Mondays. So I'm going to have a video out on Monday. I don't know what it's going to be yet, but you might want to subscribe so that you don't miss that. And follow me on Instagram, kalinjax on Instagram. Sorry about the shaky camera. I'm just keeping it real. You know, it was this or I don't do a video. And you guys take care.